Hello, Pat Zemer here with MagnaWave, welcoming you to this Tuesday edition of MagnaWave Office Hours. We come to you each week at this time on Tuesdays, noon, to take your questions, have a conversation with you, talk about machines, training, protocols, PEMF in general, whatever it is that you might like to discuss as it applies to PEMF and utilizing the MagnaWave equipment and so forth. So we're glad to be here. We're always glad to be here. We always have a good time. If you would like to talk to me today, all you got to do is send a text to 502-599-9722, and I will phone you back. That way we can control the calls coming in and out. I'll give you a call back and we can have a conversation. If you, in fact, send me a text and we have a conversation, we'll send you some MagnaWave gear. So that's an incentive. Please send me a text. Let's have a little conversation and we can go from there. 502-599-9722. If you'd like to ask a question, simply put it in your Facebook chat box or on YouTube, and I will receive it and can take your questions from there. And so chime in, tell me who's with me, where you're from, so on and so forth. Several folks with us already this morning. Good morning, Tracy. Sue's with us. Dion's with us. Grand Performance Solutions. Michelle's with us this morning. Good morning, Michelle. Danelle. Rob is with us. Beverly Johnson. Glad that you're all here. Thank you very much. Happy MagnaWave. Happy New Year to all the MagnaWavers. It's kind of how we want to approach that. So again, if you have a question, simply put it in the chat box and we will get it and we will answer your question quickly and appropriately. So we look forward to doing that. A couple of things to discuss. Number one, next week, Elaine will be joining me on the office hours and we'll be talking about the electronic version or the virtual version of MagnaCon, which is coming up in June. So you'll be able to come join us at MagnaCon is the plan at this point, or you can join us virtually online. And so Elaine will be explaining all of that, the ticket procedures and so forth, next Tuesday on office hours. So we're looking forward to that also. Also, another thing through the 8th, so there are about 3 more days. BrainTap has extended the special where you're getting 50% off on a year's worth of use for the BrainTap. You'll get the headsets, your programming for a year, the app and the whole 9 yards. So that's continued or extended through the 8th, I believe is what it is. So if you still want to take advantage of the BrainTap special that we were running until the end of the year, BrainTap's been kind enough to extend that for us and to continue to offer that special. So if you have questions, simply call the office 502 or 1-888. Let's see, now I've forgotten that one. He'll put it in the chat box here for us, but 502-749-7868 if you'd like to call the office direct or give us a call. I believe it's 833-MagnaWave. Chris will put it up there just to make sure that we're correct. So if you have any questions, we have a couple of folks that are coming in here. We'll have some questions for us, so we'll go right to the phone and give them a call. Let's see, content marketing. I'm not sure that's a thing. Here we go. Question about MW not being possible for someone after injury or facial injury. Let's get them on the phone here. Got to ring them up.
Hello?
Hello, Pat Zemer here.
Yes, this is April.
Hey, April, how are you? You have a question.
Yes. So I have a friend who had an accident with a shotgun.
Okay.
He did lose one eye.
Okay.
And he broke some bones in his face.
Mm-hmm.
He had to have the eye removed, and then he had some blurry vision in the other eye and still some swelling. His doctor okayed MagnaWave.
Okay.
We started really low. I had the sole. I tried the butterfly loop in front of the face.
Mm-hmm.
He had some additional swelling and some pain. So after talking to some other practitioners, we tried the loop around the neck, really low. That still caused some swelling, so we tried the back mat behind the head.
Mm-hmm. I
have my sole turned down as low as it can go, and he's still having some additional pressure and pain afterwards.
Here's what you want to do. Treat the upper back.
Okay.
Don't go up behind the head. He's had obviously a lot of injury and a lot of damage, and there could be some sensitivity in there. So go treat the upper back. Just treat the lungs. Just keep this in mind that we're trying to improve the blood flow, trying to improve the blood oxygenation. So if you treat the lungs, you can even drop it down a little bit below the shoulder So you're making sure you're not too close to his neck and his head. Treat the lungs, let that do its job, and that good blood will go there and do what it's supposed to do and allow the body to heal from that position. And then you're not effectively putting the signal directly into his facial area. Now, as he continues to improve, you might try it in a couple of weeks, or if you try it again and see how he does. But I would just stay away from it, treat it, and let the body do the job.
Okay, thanks, Pat.
Okay, send an email to support@MagnaWave PMF and we'll get you some gear. Great question, by the way.
Okay,
thank
you.
Bye-bye.
Bye.
Okay, had some good questions. Let's see. Bob's with us. Let's give Bob a call and see what he wants to visit with us about. This was a good start here today on the phone calls. Tanya's with us. Tina's with us this morning. Brittany.
Hello.
Good morning. Pat Zemer here.
Hey, good morning, Pat. This is Bob.
Hey, Bob. What's up?
Quick question. It's actually two questions. First one is pertaining to the brain tap. On your office hours last week with Dr. Porter, both of you have made suggestions like Dawn and I purchased a brain tap, and we're going to start using it in our business. When my brain tap did arrive, it was damaged, so I called it, and they're sending me another one, and once I get it, I'll send it back. No issue there. But when I spoke to the young lady on the phone and told her that she was asking me how I was using it, and I said, well, it's for personal use, and I'm going to be adding it to our business. She seemed to think that I needed to speak to somebody at the company, which I'm waiting for a phone call, that because I was going to do it in my business, I needed to get permission, or I needed to speak to somebody in there to use it for commercial use. And
yeah, that's all. That is all included when you buy the special. There's a way for you to do that, and I don't know off the top of my head, but if you would simply call the office, ask for Lee, she'll see that all that's squared away for you.
Call MagnaWave?
Call MagnaWave, ask for Lee, tell her what's happening, and then they can correspond with the folks at BrainTap. They may have had someone answer the phone that just was not totally up on the special that we've run in conjunction with them, and to make sure that everything is set up the way it should be.
Okay, good. I'll do that in a little bit.
Perfect.
Yep. Thank you. And second question is just on the LZR. If you're treating for like weight loss or whatnot, you can LZR through clothing, correct?
No.
No?
You don't want to do it through. It's not that the heat won't be advantageous through clothing, but you won't get the light penetration through clothing. So, but you don't have to disrobe. I mean, you can put it under the shirt or something, because you're not going to be clogging or closing that fan up. So you could put it under someone's shirt or their blouse if you're doing the midsection, and just work across the body and then treat with the PEMF.
Gotcha. Okay, thank you.
Okay, you're welcome. Support at MagnaWave PMF. We'll get you some gear.
All right, thank you very much.
Have a great day. Bye-bye.
Bye-bye.
Okay, some good questions. Got another question here. Sophia's writing, and let's get Sophia on the line. Okay, let's see. Tanya's do have a question from Johnson's Edge. Suzanne's with us. Good morning, Suzanne. Glad you're with us. Let's see. No other questions. The phone is working today.
Hi, this is Sophia.
Hey, Sophia. Pat Zemer with MagnaWave.
Hi. Thanks so much for getting back to me.
No problem.
I have a couple of questions for you. The first is for equine windpup. I haven't treated that before, and wanted to know if you had any suggestions. I work with a semi-5.
Yeah, no, I would just treat right over where the issue is. I'd use the butterfly typically, or I'd use the large loop kind of wrapped around the area, and just treat away. Now I would also treat above and below, so you've got good circulation above and below the area, and so it can be moved appropriately.
Okay, great. That's super helpful. And then my second question is a little more challenging for me. I've been working on a canine, a dog with spinal inflammation since July, And we started out with several times a week, and then he was doing well, and then moved it back to once a week, and then back to once every other week. But in the last, I would say, 3 weeks, his mobility has decreased. It's like it's not as effective as it was. So we're kind of going backwards.
Well, here's what can happen. I don't know exactly the situation on this, and of course the veterinarian would be very beneficial here, but if you were going every day and then you slowed down to once a week and then every other week, those problems, if they're anatomical, so there's something, whether it's a pinch or something going on in the body, excuse me, if you stop treating, it's going to come back. It's not always a situation that you can get it to where it's working well and you can drop back to once every 2 weeks and you can hold it. Sometimes you can do that. Sometimes you can treat once a week and you're fine, but you may have to find a medium in there to where maybe you're treating 3 times a week in order to keep things going well.
Yeah, it sounds like that's what it was, because I mean, we really kind of played it by ear and adjusted as the dog's mobility improved, and
right.
It was improving, and he was fine, and he wasn't falling over. You know, his legs would just kind of fall out, you know, from underneath him.
Right.
And the vet said they couldn't really get an accurate diagnosis of how to fix it because it's spinal inflammation. So,
right.
So it was working really well. His mobility was great. He wasn't having any more issues. But then, just like I said, in the last 2 to 3 weeks, all of a sudden they all kind of came back. So
but yeah,
I'm guessing I need to repeat that.
Correct.
A couple times a week protocol.
Yes, ramp up
back to where we started.
Exactly. Ramp up your treatments again, and then you'll just look for that happy medium. You might get him to where you're able to treat him 3 times for a week, and then 1 time the next week, then 3 times the next week, and he holds on fine. You just have to kind of figure that out. So obviously the inflammation is caused by an anatomical condition, but whether it's a pinch or an injury that's there, and it's going to reoccur, and which is unfortunate. We always want to treat something, get the inflammation out, and it doesn't come back, but that's not always the case.
I know. It's like I was feeling so good about this client. Everybody was happy, and I was feeling really dispirited about it.
Right.
But we'll just do our best. So thanks for the tips. I really appreciate it.
Send an email to support@MagnaWave PEMF when you get you some gear.
Okay. Thanks, Pat.
Thank you. Have a great day. Bye-bye.
Bye-bye.
Okay, let's see here. Here's another one from Sue. Let's get Sue on the phone. And boy, this is working out better today, I think, than it ever has. Then I will do the one that was put in the chat box.
Hello.
Good morning, Pat Ziemer here.
Hey, Pat. I picked up a client that's horse is suffering from moon blindness, okay? And it's just recently started showing the symptoms and having issues with it. So I started doing a treatment on it, and I spent about 10 minutes on it with the small butterfly off of the eye. Am I doing it correctly? I mean, is that what I should be doing?
Well, that's fine to do that. I would also maybe use the butterfly or the large loop on the pole area and kind of penetrate down through the head above the eye. Can try that. Would be potentially of some benefit, and to see how things flow from there. Also to treat the neck and the lung area, so we got good overall blood flow through the body, could add some strength and stability to what you're searching for.
Okay, because right now she's really concerned about the inflammation because it's painful also for him.
Sure.
That's an old guy.
Sure. So if you want to put, again, come out, you could even do the large loop, put it kind of over both eyes and just kind of put it on a very comfortable setting and treat from that area and work on the inflammation. That's what we want to do, is try to get rid of the inflammation.
Okay. And how often should I recommend to do this? I'm going back on Friday, which I prefer to come do it either today or tomorrow again.
When did you last do it?
I saw him on Sunday.
Yeah, in those types of situations, when something is new or acute, I always like, if possible, if it works out with the client and with the practitioner, maybe do 3 or 4 or 5 days in a row, then lay off for a few days and see how once a week does or how things progress at that point. But quite often when you have these types of situations where the inflammation is there, you treat it one time, yes, the body's saying, okay, good, I'm happy, I got good oxygen in your blood, things are flowing well, maybe we've reduced a little of the inflammation, then we take off, and whatever's causing the inflammation is going to come right back and begin to attack the issue. And so quite often we want to get ahead of what's going on. That's what I've always said. Let's get ahead of the inflammation, ahead of the problem, and then treat accordingly to regulate and to maintain what we want. And if possible, be able to get it to a point that we've helped the body reverse itself totally and don't need it anymore.
Okay.
Okay, dope.
I appreciate it.
All right. Thank you. Appreciate it. Support at MagnaWave PEMF. Yes, I'll do it. Bye-bye.
Bye-bye.
Wow, getting some really good questions today. Let's see. I believe we have another one. Yep, got another one here. Oh, let me answer this one. Client was recently diagnosed with melanoma on the head using my Semi 3 daily. Do you still recommend doubling session time with this machine? HydroWave would help. You know, if you're doing on the head and it's comfortable, you don't have to double it all the time, because you would not use a bigger machine much higher than probably what you are now with the Semi 3. So I would 6 to 8, 10 minutes in that area of the head coming up from the shoulders or treating right near the area should certainly be ample, and that's how I would approach it. To use some HydroWave on the area to help keep things clean and to stimulate the tissue could be very beneficial as well. And so now let me go to the next question. I think that answered the question totally. Let's see, any other questions? People are talking about the paddle on the wind puff is great. Let me look here. Zoom paddle is good to use. LTC from hello from Arizona. Yes. John Stevens is with us this morning. Can MagnaWave help with skin issues such as eczema, psoriasis? Can it maybe help with the pain from it, or if not, clear it up? Well, certainly in those areas, you're going to improve the blood flow, improve the oxygenation, take away the inflammation. I know we've used a PEMF MagnaWave on shingles, and it helps take away the inflammation and control the itching. So certainly to use it on those areas in conjunction with whatever medication the doctor or the veterinarian is prescribing to be used on the area. But it can be, now again, you're dealing with something that is caused by in the body, a chemical reaction or a deficiency in the body that allows the eczema and the psoriasis to be there. So they got to deal with that also, but then we can work on the external areas of the body to be of service to that. So there you go. I'll come back to that. Let's go have a look here with Tanya. John's got another issue or another question.
Hello.
Good morning. Pat Zemer here.
Good morning.
What's up?
I am curious. I have a 2-year-old that came in the other day, or we did chores, and his back leg, the whole cannon bone area is swollen. Mm-hmm. He doesn't appear to be sore. He's still running around playing. So of course I brought him in, and I did kind of a quick full body. I have the extra large wave wings, so just did everything and then worked down the leg, and haven't seen any improvement. And then I did 4 hours of back on track wraps, and I'm going to treat him again. But the thing that my question is, it's almost like memory foam. You can squeeze it, and then that dent will stay there and eventually fill back in. What is that, and what should I do?
I can't answer that not being a doctor or a veterinarian, but certainly you got a lot of things going on there in the tissue that you want to get rid of. Now, the biggest question that I would probably have is, where is it coming from? That's where you're getting the inflammation and the pain. But is there any referral? referral from the upper leg or another area of the body, or is there a referral from the foot? So I would kind of do a little of, you did the whole body, and that's been beneficial. So you might approach it from that type of position, maybe under the foot coming up, and to see if you can get some relief there. But again, if there's something causing it that's anatomical, is there a chip? Is there a pinch? Is there something that's causing this to start and cause the problem, to the inflammation? You also got to be able to get after that. I would say, and it's kind of been a rule of thumb for me, if I'm treating an area on an animal and I treat it 3 or 4 times and get no change, and nothing is happening, that's, the vet needs to have a look and be able to understand what it may be. If it's something that the blood flow and the oxygenation and the reduced inflammation can allow the body to easily speed up its healing or enable the healing process, bingo, we win. But if there's something else going on, we got to know that. And it's always been a rule. If I treat an animal today and he's better tomorrow, but then he's worse, and I treat him again and he's not any better, and I treat him again and he's not any better, call the vet. And because you've tried to do some surface things, but it's not getting there, contact the vet.
Okay.
And
I have the Semi-3. And I feel like I kind of know this, but I'm just curious to hear your take on it. How should I treat him? Which attachment? And
I would probably recommend the butterfly right over the area. And then I would use the large loop, and I'd wrap the leg and let it go up and down. You understand what I mean? When you have the large loop and you wrap it like the hot dog, and then you're going up and down the leg. And then use the butterfly to go in the other direction and just kind of treat the area. I would also treat shoulder and above and or hip and wherever, and come down and get good blood flow coming through the leg. Okay, doke.
Great. Thank you so much.
You're welcome. Have a great day. Support at MagnaWave PEMF.
Will do. Thanks. Bye-bye.
Bye-bye. Wow, we got a lot of calls coming in. Let's see. Another question. Last week, Elaine spoke about rental business model. Could you please expand a few successful examples of how to set this up? What points should be considered in pursuing it before pursuing it? Well, it kind of evolved. That type of situation with the rental certainly evolved with the onset of the COVID. Some people didn't want to go to farms. Some people didn't want you on the farm. People were frightened as to what they would do. So it was a situation that you could rent a machine to the client, instruct them on how to utilize it, do that, and then have the benefit of what you're doing. And so that's the main thing to look at. You might ask your clients, or if you know that people that are having a situation where they could use a machine for a week or 2 or 3 or a month or whatever the situation may be, if they'd be interested in doing that. So I'd cross a couple of those bridges going in. You don't want to necessarily do this and then say, hey, I've got this thing for rent, and everybody starts telling you, come out and see me, come out and see me. Then you got a machine to rent. But that would be one way to approach it, to let people know that you have this capability, that they can utilize it. And many times they need that. How often have you heard me say, oh, let's treat it 4 or 5 times in a row and then treat it once a week, or treat it for 2 weeks pretty consistently and go with it. But you're 50 miles away, or you don't only get to that barn or that area once a week. And so with the rental type of capability, you could have a few machines, and people are doing that very successfully and being able to place them where they need them and utilize it in that fashion. So that'd be my recommendation there. Talking about the rental program. If you want to get a little more specific, I'd call and ask for your product specialist, or talk with Elaine or Cameron in the office, and they can give you many more examples of who's using it, how they're using it, and so forth. And in fact, some of the folks that are watching today are in fact doing the rental program, and they can perhaps respond or give you some information there to go a little deeper into that. And there you go. Hope that helps. Let's see, let's have a question here on training. Mini horse, get my phone in. Ivy's got a question. I'll get to it here in just a minute, Ivy. We'll get to that question.
Hello?
Hello, Pat Zemer here with MagnaWave.
Hi, Pat. Our mini horse ended up getting apparently injuring her stifle. And she has a fusion over both stifles. The right is the worst. she was holding her legs really stiff and shifting her weight back and forth. The vet was out, wasn't positive what was going on. The chiropractic acupuncture vet was out. He thinks she tore a cruciate ligament. So I've been MagnaWaving her almost daily. I also have been doing photopuncture, and I also have a red infrared light, and I've been doing 2 modalities a day and alternating, and she's improving a lot. But I was wondering, frequency, how often I've been semi-3, how often and how long I've been doing, mostly using the butterfly or the large loop on the low back, mid to low back, and then going down and putting the butterfly around the stifle.
Sure. And it sounds like to me you're doing the right thing. If she's improving, I would stay with it. You might, if they want you to do this, you might stop for a couple of days and see if there's any regression or how long it will hold. But, the biggest challenge is once you get ahead of it, you want to finish the race. You don't want to get it to a point that we're almost there and then you stop and then all of a sudden it starts creeping back before we got a chance to really try to resolve the issue.
Okay.
So frequency is really going to be dictated by the animal. If the animal's holding well and you get it to where you can treat it once a week, once a month, whatever it is, that's wonderful. That would be the best place to be. But going in, you want to head after it as much as necessary to get it to where you want it, to where it stays.
Okay. And any timeline for ligament injuries, like in your experience, how long? So
often it's the severity of the injury. If it was a severe injury, it's going to take longer. Nerve and cartilage is always slower healing than softer tissue, muscle tissue, and so forth. So to put a number to it is difficult because, like I say, it could be something that it might take 3 months to really heal, or 4 months, but you may not have to treat it every day or 3 times, but you just may need to stay after it for that period of time.
Okay.
Okay.
Thanks.
Okay. Thank you. Support it. Yep. Bye-bye. Support at MagnaWave PEMF. Send you some gear. We got a lot of gear, Chris, this week we're going to be talking to people about. Lori's here. Let's see. Ivy had a question. I was told machine rental or financing are not available to Canadians. Is that true? If not, do clients get machine directly to their home after the purchase with the first payment, or only after they have paid for the machine entirely before receiving the machine? That really depends on their situation. The challenge in Canada is certainly customs, what the charges are, how it's done, and because Canada wants their GSA or whatever it's called as far as their import duties and all of that kind of stuff. Ivy, the best thing to do in this case would be call the office, ask for Cameron, or talk to your product specialist that you've been dealing with and specifically ask that question, and they can approach it accordingly. The other challenge, and I hate that it's there, but on international type situations, if someone's in the next state or 3 or 4 states over and they decide they're not going to be a straight up person and not return a machine, it's much easier to get a hold of, or it's much easier to get things handled in the United States. But when you cross into international countries or into other countries, it gets a little more difficult. And we would love to be able to service everybody in that type situation, but we have to look at the realities of business as well and to what's good, because if you have a lot of those and we don't have a lot of them, but you do have them, and so you need to set yourself up accordingly. So I hope that helps, Ivy. Call the office. You can start with Lee if you'd like. Tell her what the situation is. She can approach it for you, and Lee in customer service, or talk to your product specialist straight away. So let's see. We do have another call here from Lori. Let me get Lori on the line. Here we go. And Becky's with us from Arizona. Hello, Becky. Sandy's with us. Good morning from California. Hazel's with us also this morning on Castbox. And hello, Pat Zemer here.
Hi, Lori Reese here.
Yes.
So I had an awesome experience with a client that hired me to help with her horse that didn't do a serious tear, but it was like many small tears. I think the superficial and deep digital tendon. And they found a vet in Colorado, Dr. Selsberg, I think his name is, and he has been performing what's called Tedx on horses, which is the procedure where they go in and microscopically remove scar tissue from the tendon. They didn't actually sever the tendon or do anything of that sort, but they cleaned out all the scar tissue to give the tendon every chance to grow back stronger.
Correct.
And so I was hired to manually manipulate and MagnaWave 3 to 4 times a week for 60 days.
Okay.
So we just had the 60-day checkup, and this vet ultrasounding, A, could not find the tears.
Wow.
And B, could not find 1 little ounce of scar tissue.
That's wonderful.
So, yeah, this is the future here. You know, this is a very expensive surgery. I don't want to say surgery. It's a procedure.
Correct.
And Dr. Daniels he has his private firm in Wellington, Florida.
Right.
And I think everybody's going to be seeing more and more about this. It's amazing. You know, this horse not only is going to get her life back, but this horse will be back in the show ring. And
that's incredible. It's just amazing that those kind of things occur. And it's just about helping the nutrition of the cells, helping the oxygen, allow them to flow the way they're supposed to do what they're supposed to do, and they'll do their job.
Yeah, it's intensive. I mean, I'm not going to lie. It took a lot of effort on my part and the owners for 4 to, 5 days a week, doing the hand walking, the icing. I mean, it was aggressive. We were very aggressive. But.
Well, and that's what I was talking about a little earlier. When you're dealing with a vet or you're in a particular situation, everybody wants. I mean, I can't tell you how many times, and you've probably received it too. Okay, my horse has got a sore back, or I got this problem. Please come treat it today. Are we finished? Yeah. Well, I've maybe in the last 20 years, I've maybe had 3 or 4 or 5 situations where I treated an animal and they were really done. I mean, they recovered perfectly and they didn't need any additional things. But a lot of cases, and I always ask the question, you're going to race this horse again? You're going to ride it next week? You're going to work it? Yes, then, you may need additional things completed. And so that's just... But they did the right thing by giving you 4 or 5 times a week, 60 days. You really got a chance to go after it, and that's wonderful.
Well, to tell you the truth, she moved her horse into my barn so that I could do it.
There you go.
So I've all of a sudden turned into a therapy barn here in South Florida. Everybody's bringing their horses. So
right.
I'm the only one that's really going to sit and commit that kind of time and effort into it.
Where are you exactly?
So it's outside, it's west of Fort Lauderdale. It's right where Alligator Alley turns south again.
Okay.
It's like Weston, Southwest Ranches.
Okay. Yeah. Okay.
And, it's great because there's a lot of very expensive warm bloods here that their careers are cut very quickly with one tendon issue. And in fact, they couldn't even figure it out. They thought it was a check ligament. But luckily, this owner was aggressive and got the right people and found it.
Send me an email to Pat at MWPEMF. Tell me where you are. I'm about I don't know, probably 70 miles north of you. I'm in Jupiter.
Oh yeah.
Yeah, okay. And maybe we can get down there and connect.
Yeah, I think you would love to see this. This is definitely the next stage.
That'd be great. Maybe we can get an interview. That would be wonderful.
I would love it.
All right.
All right, thanks. I'll do it. I'll send you an email later today.
Okay, thank you. Have a great day.
You too.
Bye-bye. Wow, that's just amazing, the things we continue to hear and discuss, and of course you can see this when you go to the practitioner page. You can see it, or if you're not a practitioner, you go to the MagnaWave International Research and PEMF page. I probably said that wrong, but they'll put it up for you. You can go there and search particular indications, and they will pull up what practitioners have done, and so you can get a lot of that. And also the MagnaWavePEMF.com website. Go to the research tab and you can see all of these types of stories. And if you have a story like that, just like Lori just shared with us, it's great because it gives people great incentive and great background or how they might handle a particular situation. It also gives you great information to share with your veterinarian. They have a horse that's had this similar kind of thing. Well, look, this is what somebody did, and here's what was the results, and let's proceed down this way. And so that's what I would encourage you to do. Go to the MagnaWave International research page and the research and education page, group page in Facebook. You can ask a question, you can search, all of that is there. And it's certainly, if you're a practitioner, you can get some of this information from the practitioner page or the training portal. It's all in there. And if you'd like to talk to somebody about it, you can call and talk with Teresa or Erin. Talk to Erin, and she's been our director of training and working with us on our clinic development and that stuff now. And but Erin is a wealth of information. She's been doing it for a long time. She was our first hire and outside of Elaine, and so we were very excited about that. And Teresa's now handling the certification program and all the training, so you can get the results that you're looking for there. So please give them a shot. If you'd like to send me a text, 502-599-9722, I will phone you back and we can have a conversation. If you do that, we'll send you some gear. Let's see, Rick. Happy New Year. Thank you. Germantown, Tennessee. We were talking about Germantown the other day, as a matter of fact. I have some friends that are dressage folks that are neighbors here, and they're from Knoxville, but we know where the area is and what you're doing. What is the procedure mentioned in that last call, 10X? Maureen, that's a great question, and maybe we can get Lori. Was that Lori? Let me see if I can get her back on the phone and she can tell us that. Let's bring her back, if she's available to come back. Great question, Maureen.
Lori here.
Hey, Lori, Pat Zemer again. Quick question.
Sure.
What's the 10X?
Okay, so 10X, if you look it up, it's TENEX. It's not normally done on horses. I think this vet is crossing into using it from athletes, but it's basically a microscopic laser that goes into the leg, and it's kind of like back in the day, liposuction. It's just basically lasers out and sucks out the scar tissue. Okay,
so it's a laser procedure that they actually can penetrate. So it's not a cold laser. It's a more of a hot laser that they utilize. Almost.
I think it's in the leg. You know, it's very, I'm pretty sure, the horse didn't have to go into like a hospital. They actually did it at the stables, but they sterilized the area, and I think the horse was standing.
Yeah, cool. Maureen said thank you. So she was asking that question. So thank you very much for taking my call.
Yeah, you betcha.
Bye-bye.
Okay, bye-bye.
Wow, great. I was going to ask that when she said it, but it just kind of got beyond me and we got to talking about the other stuff. So always a lot of good things there to learn. The integration of multiple therapies together is something that is very beneficial. If we've always maintained that complementary procedures, complementary devices are a way to look at things. I mean, when someone says, oh no, this doesn't work, I only use this, that's fine. If that's how they feel and they're getting the success they want, great. But those who are, it's like Dr. Marty's always talked about, and so if the integrative aspect of being able to use multiple modalities and multiple things to come together to get the result that we're looking for is often quite beneficial to what we're looking to achieve. Let's see, 10X, Maureen, okay. Multiple modalities rock. There you go. And that's, of course, we're doing more and more of that with the brain tap and the LZR and the devices. We're talking with some folks on developing a red light bed and being able to integrate that into people who have, and we've done that with the Wave Oasis and the vibration and the frequencies. Everything can really balance and work together. We're working with some clinic procedures on a float tank situation and putting PEMF into a float tank and being able to get the energy going from that perspective. So there's a lot of things that are under development that we're working towards, and that's always fun. And it's certainly for those in a business capacity to look at ways to build their business. That's what it's all about. If we can have, and I'm amazed when I look at the number of people that are dealing and doing treatments, and the number of people that we're addressing is just it's very humbling, and but it's certainly fun to have a look at and to pursue. Let's see. Here's a couple more calls. Devin has a question. can't aggressive. All right, let's pull. Oh, where'd Devin go? Let's get Devin on the phone here, talking about sounds like a cancerous situation. Got a few more minutes left. We're doing good. Great calls today.
Hello?
Hello, Pat Zemer here.
Hi, yes, this is Devin.
Yes.
I have a question about a dog I've been treating with a very aggressive type of cancer.
Mm-hmm.
It's called acanthomatous ameloblastoma. And he has a tumor on his lower jaw.
Mm-hmm.
I've been treating him 3 times a week for about 2 months. I'm using the paddle for about 20 minutes. I have the semi-5.
Mm-hmm.
The tumor has not grown, which is
good.
Much better than what the vets anticipated. They thought that the tumor since it's so aggressive, they thought it would grow to the point where he would lose quality of life within 2 to 3 months, and that was back in September. So it hasn't grown, which is good, but it also hasn't shrunk. It's starting to look like more pitted around the whole tumor, but the owner was hoping, obviously, that it would shrink to avoid doing the surgery where they had to remove that part of the jaw.
Right.
Is there anything I could be doing differently?
Which machine do you have?
A semi-5.
Okay. And you're using the paddle.
Mm-hmm.
And how long is your treatment? 20 minutes.
20 minutes.
Yeah, that's, wow. We'll if you would put that in the form of an email.
Sure.
And send that to me or to Elaine, and we'll reach out to Dr. Marty because he's done a lot of work in the cancer area and can talk about that. We've had a lot of tumors that shrink, that make them easier to remove, but you may have a situation here because of the aggressiveness. That's kind of like when you talked about the blastoma part of the thing. A lot of these tumors are so aggressive that they don't give you a break at all. I mean, if you just and so like in the brain tumors, the glioblastoma, where they use PEMF to try to get after it, they're not saying that it's going to eliminate the tumors and heal the person, but it extends quality of life, and in many cases for years and years. And by being able to approach it or to keep them from growing, that's the challenge when you get into those areas like the jaw or the brain or something like that. It grows to the point that, oh my gosh, it's just taking control, and then you know what happens. So that's the thing. If the vets are happy, I don't know. There are some processes where people have, and I forget what it was called, but we worked with this company a year or so ago on developing some procedures. But they'll go in and they'll inject a chemo type of drug directly into the tumor, and then approach it with electromagnetic therapy or another form of therapy to then kill it or try to get it to go down even more. There could be that aspect that might be a benefit in this case.
Okay, yeah, that's definitely something to look into.
Correct.
But I will email that question. He had actually a fatty tumor that's responded very well.
Right.
To the MagnaWave, and also he was a little arthritic, which has responded well, but this tumor is just very persistent. So
yeah, and
I think it might just be the type. And
it could be, and that's some things. But we can send that to Marty, and he'll have a look at it and give us a response.
Okay, perfect. That would be great.
Thank you very much.
Thank you so much.
Bye-bye. Bye-bye. Folks, don't forget, support at MagnaWavePEMF.com for some MagnaWave gear. Message about question. All right, let's give old Carly a call here and see what's going on. Time's moving right along.
Hello.
Yes, Pat Zemer here.
Hey there, it's Carly. How are you?
Hi, Carly.
So I know that the modalities or certain modalities can complement each other, and I am meeting with a massage therapist tomorrow to go over the benefits for the human side of things. I usually work on dogs. So while I know the modalities complement each other, are there some key things I should mention tomorrow to kind of help get her to understand how they can?
Well, yeah, I mean, you can talk about quite often in massage therapy. For example, a massage therapist that my wife sees a lot in Louisville, and I took a fall a couple of weeks ago and hyperextended my leg and the hamstring muscle, but I fell on my shoulder, and I've had a lot of complication mid-back from falling on my shoulder. And and so I've been treating that, and I went to my wife's massage therapist, and he found the area and he treated it. He helped release it. He has PEMF in his office. He has the what we call the Vesta Dual, now the Semi 5 Dual, and he loves it, and he uses it all the time, and he used it on me that day. What happened in that case is I got some immediate relief, but I really jammed things up, and of course we left town, and 2 or 3 days later, bingo, it's back. So now I'm trying to be persistent and treat it a couple of times a day to get ahead of it. But that's what you really need to do, is to kind of take a look at it from that type of perspective and take the time to do that.
So would you do PEMF before or after a massage?
Well, and again, that kind of depends on the client and what's going on. If someone is tight, I've had massage therapists and chiropractors treat prior to their massage to loosen up the shoulders or the back or wherever the situation may be, and that makes their treatment, it's not that they notice that it's easier because they use a lot of deep penetration, but it just allows the body to be more receptive to what they're doing as they do their procedure. Then quite often what happens is, once you've completed the procedure, you put things back where they belong, or you've gotten rid of that knot that's causing a problem, then you can do the PEMF to help further that along, help push the inflammation out and make things better. So I had one client, Steve was a practitioner, and we lost him. Unfortunately, he died, and it was sad days, but because I love Steve. But at any rate, Steve's wife was a chiropractor, and they would go out and he would treat the horse for 10 minutes. She would do her adjustment and work on the animal. Then he would come back and treat it again for 10 or 20 minutes afterwards, and their results were incredible. And yes, and you'll see, and I'm kind of talking chiropractic here, but I was in Phoenix, Arizona. I was talking with I had a practitioner, and he took me to a chiropractor, and this guy's doing horses and adjusting their necks and doing this kind of stuff. And he said, I got this problem on this stretch of this horse through his shoulders, and you're not going to help that. And I said, I'm going to tell you what we're going to do. We're going to treat that horse for 10 minutes, then do your treatment. He was amazed at how he got better flexation, better management. The horse didn't fight him. The horse would always fight him. The horse was a little more comfortable and didn't fight what he was trying to do. Same thing in a person when you're working with them as far as massage therapy goes. You know, people have a tendency to say, oh, you know, my massage therapy or my laser or why this and that is ample, and I don't need to do anything else. And that's not always the case. So getting them to understand that, and another logical way to do it is one of the first things that goes on a massage therapist, particularly on animals, but is their hands, their arms, and that type of thing. Treat them. Treat their shoulders and their arms, and then have them do their massage on you or on their next person, and let them see how it feels differently as far as what they do. So to have those kind of conversations with the massage therapist would be very beneficial. And something that I've often talked about with chiropractors and massage therapists as well, and Harry, the massage therapist I was telling you about, again, you can make someone feel better. You can get some better range of motion, some better inflammation reduction. They can feel better immediately after the treatment. Why not come in and just put a little enhancement to what's going on and stretch that along?
Right. Okay.
Okay.
Well, thank you very much for the info.
Welcome. Have a great day. Support at MagnaWave PEMF for some gear. Okay, great questions. That was that. We're getting real close on time. Let's see. John ask the question, any way I know how, any news on CE? We should have it in the European. We do now have, as we've pointed out, we have Health Canada. That's all taken care of. And the CE is supposed to be right behind. The factory in California was awaiting their final inspection virtually. I think they were going to do an inspection virtually. I will ask the office or Lee to do a call on that today and post it in the practitioner page, John, so we can see as of today what the latest is on that. I do know that they've changed all their labeling on the information on the machines that shows that they're Health Canada, that they do, that they're doing all the right things as far as that's concerned, from FDA requirements in the United States. That whole bubble is that whole environment is kind of changing to where they're wanting to make sure that people are in fact testing their devices and not making claims and that type of stuff. So we will ask those questions and put that on the practitioner page for you, John, later today, if that's okay. Leslie talks about, it's called electro chemo. Oh, that's it. Electro chemotherapy, to where they inject the chemo right. Thank you, Leslie, for sharing that. I couldn't remember exactly what it was called. My business development manager, Art, has a good relationship with those people. We can reach out and see the availability. They're in the Tennessee area, and they're in clinics around the country doing these types of procedures as well. And so, but that is what it is. You might want to search that up. I believe it was Lori that was asking those questions, and have a look at that in order to approach that tumor from that perspective. I know, hope Brexit doesn't change things again. I know, the Brexit's obviously changing a lot of things, and the COVID, as it's flaring, all of a sudden causes issues and finishing things up. But we'll try to get that as much as we can on that answer for you, John, later on today, and put it onto the group page. Well, thank you for the folks on Castbox that have joined us today. We're about out of time. If I get another call, I'll take it here in the next minute. Or if you have a question, please post it and we'll have it up there. Oh, here we go. Rob asks a question. If we already have a machine in Canada, do we need any labels or anything for our machines relating to Health Canada? Yes, they can send you, we can send you, the factory can send you labels to attach to those machines showing, as long as it's one of the machines that was tested, and I'm sure that it probably is, and to bring you along to that situation. Which machine do you have, Rob? If you could put that in there for me, I will have a look. That way I won't be saying something that is not correct. The machines that have been tested that are being used for CE and Health Canada and for our FDA here in the United States are the digital devices. The analog devices, the older machines like the MagnaWave Max, are just now going back through the safety testing and procedures for that. On the other side of the house, the Pulse Pro devices from that manufacturer are also into the safety areas of testing for and are moving along for Health Canada and for CE as well. So they're doing their job to try to bring those machines, or not trying, they are bringing those devices into this same thing. One of those devices that they're working with is a combination. It's as you know, the Julian and those machines are now digitally controlled spark chamber devices that are being used. And so that's we're doing the same thing with the digitally controlled spark chamber devices. They've already been through preliminary testing that they're working with the PEMF solutions and to move down that road. So Rob's got a Julian. Rob, the Julian, as I was just describing, is in a different process. It's a different CE situation, but as that progresses, which it is, it's in the state of testing, safety testing, and then ISO certifications and the various manufacturing methods that then can take that to Health Canada. So that one's a little different, but we are moving down that road as well. Wendy asks a question, has a horse with chronic diarrhea. I've started a colic treatment as well as massage. Would you also suggest hydrowave water in this instance? Well, to put the oxygenated and the micro small elements of silver into the bloodstream, into the body, could be very beneficial to the health of that area if there is something going on that the water can help get at to eliminate, certainly would not hurt the situation to approach that type of situation with the HydroWave. Just put a couple ounces or a couple ounces into their regular drinking water once a day, and that'll help put those molecules into the body to do what silver does in the better oxygenation to help those types of situations. Wow. Great questions. Great program today. I really want to thank you for joining me. We'll be back next Tuesday with another edition of MagnaWave Office Hours. Be sure to catch us on Roku, Fire TV, Biohacking Wellness is the channel that we have, and we're putting the programs up there all the time. We had a little problem with the way things were going, but we're back on track to begin loading these office hours and other interviews and things that we do. So check that out. And Hazel, thank you for being with us today. Maureen, thank you, everyone. Thank you very much for being with us. So with that said, wave on to better health. Have a great day, and we look to see you next week. Bye-bye.